Navigating breast cancer surgery. Understanding lumpectomy versus mastectomy, a breast cancer diagnosis, often brings a critical decision. Which surgical path is right for you? While the choice can feel overwhelming, medical data shows that for many types of early-stage breast cancer, both a lumpectomy and a mastectomy offer similar long-term survival outcomes. The decision is less about which surgery is more effective at curing the cancer and more about balancing physical recovery, lifestyle, and emotional well-being. Comparing the surgical approaches, understanding the fundamental differences between these two procedures is the first step in making an informed choice. Lumpectomy, partial mastectomy. A lumpectomy is a breast-conserving surgery. The surgeon removes only the tumor and a small margin of surrounding healthy tissue to ensure no cancer cells remain. Pros: preserves the natural shape of the breast and maintains more sensation in the skin and nipple. Cons: most patients will require radiation therapy afterward to minimize the risk of recurrence. Note: recent research indicates that women over 65 with early-stage cancer may occasionally avoid radiation without compromising survival. Mastectomy. A mastectomy is more extensive, involving the removal of the entire breast, including the nipple and areola. Pros: some patients choose this to avoid the need for radiation or to simplify their treatment schedule. Cons: it is a more invasive procedure and may require reconstructive surgery, either immediately or later. Follow-up, depending on the pathology, such as tumor size or lymph node involvement, radiation may still be necessary even after a mastectomy. Debunking 3 common misconceptions. Medical experts emphasize that several common-sense assumptions about breast cancer surgery are actually contradicted by clinical data. A mastectomy offers a better chance of survival. The reality: long-term studies demonstrate that patients who undergo a lumpectomy followed by radiation have the same survival rates as those who undergo a mastectomy. Removing the entire breast does not inherently increase your lifespan. A mastectomy guarantees the cancer won't return. The reality: while a mastectomy reduces the risk of recurrence in that specific breast, it is not a total guarantee. Approximately 1 in 20 patients will see cancer return in the same area after a mastectomy. Furthermore, a mastectomy does not lower the risk of cancer developing in the other breast or spreading to other parts of the body. Surgery dictates my need for chemotherapy or hormone therapy. The reality: the choice of surgery does not determine your systemic treatment. Whether you need chemotherapy, hormone therapy, or targeted therapy depends on the biological characteristics of the tumor, such as its HER2 status and hormone receptors, rather than how much tissue was removed during surgery. Making your decision. Factors to consider: since survival rates are often comparable, your decision should be guided by your personal priorities and lifestyle. Recovery and body image. Lumpectomies generally offer a faster recovery and higher levels of satisfaction regarding body image and sexual health. Treatment logistics. If you cannot commit to daily trips to a radiation center for several weeks, a mastectomy might be a more practical option. Psychological impact. For some, the peace of mind of having the entire breast removed outweighs the benefits of breast conservation, especially if the fear of recurrence causes significant anxiety. Key insight: the best surgery is highly individual. It is a balance between oncological necessity and the quality of life you wish to maintain during and after treatment. Conclusion: ultimately, both lumpectomy and mastectomy are effective tools for treating breast cancer, with similar long-term survival outcomes for many patients. Your choice should be based on a personalized discussion with your medical team regarding your tumor's specific biology, your ability to undergo radiation, and your personal goals for physical and emotional recovery.